During this semester, when we've talked about strength, we've been talking about how to do a manual muscle test, and you've spent so much time learning all of the exact positions and the hand placements. But today we're going to talk about alternatives to manual muscle testing, whether it be functional or 1 rep max, and so we'll have a different perspective today. When we assess our patient's strength, whether it's through a manual muscle test or the functional test that we will talk about today, we are trying to get an idea of that patient's motor performance. How can they perform a task? And so if we're looking at that task specific, we do want to make sure that we always have our tasks be safe and the most efficient for our patients, as well as functional, something that they are going to be able to replicate at home. When we're thinking about these tasks, we also have to think about different factors that could influence our patient's performance. We're going to discuss individual factors, task-specific factors, and environmental factors. So as we go through this, there's an example there written on the slide. Will you be able to perform a golf swing safely, efficiently, and functionally if you have one arm and it's snowing? So there it gives you some individual factors as well as environmental, and we'll discuss on the upcoming slides. There are some individual factors that can affect the performance of a task. The first listed there is cognition. Does your patient understand what you are asking them to do through your instructions of the task? If they have an impairment in their cognition, their performance may suffer just from a lack of understanding of the task. Muscle strength. So we've been talking about this all semester. So if you did do a manual muscle test, do they actually have the muscle strength that is required for that task? How about their range of motion? Is it pain-free? Do they have full range of motion? If they don't have the full range of motion, or if the patient's experiencing pain, definitely going to impact their performance of a task. Endurance. Do they have the strength to last over time? When we do manual muscle testing, we're doing a break test, and it is not really requiring endurance of our muscles. So if we're doing a task that requires more time or muscle endurance, we may see a difference in performance, even though maybe their manual muscle test score was a 4 to 5 range. And then also power, looking at that explosive strength. Do they have enough power to perform the activity? Maybe it's a task that requires jumping or something that's explosive. Do they have that type of strength, that type of power? The task itself can have different factors which will impact performance of that patient to complete it. Is it a simple task? It is something that they do all the time, that they have an understanding of sit to stand, maybe static standing, sitting with upright posture? Or is it a complex task? Maybe walking and then walking over uneven terrain, riding a bike, driving a car, tasks that are going to involve muscle performance as well as cognition. So obviously the more complex the task, the more demanding that will be on our patient and could have an impact on their performance of that task. And then environmental factors can have an impact on task performance. How does the environment affect the task? So if we're talking about that simple task of sit to stand, what is the height of the chair or the surface? We all know that the lower the surface, the more demanding of the task. Same thing with curb or stairs, the higher the step. Or if our patient has to change surfaces to walk on, is it carpet or tile? Or is it something that's more stable, or is it compliant? Are they walking on loose stones? Are they having to carry something? Is the lighting poor? So what are the factors that the environment plays and how it can impact the performance of our patients? So why do we assess the strength of our patients? And it's really to see if they have that strength component that's required for functional movement. We can actually look at strength through 3 different categories. ADLs, activities of daily living. So actually having them perform the ADL and see do they have the strength to complete the activity. We have functional strength tests that we'll talk about, as well as using equipment-based strength assessments. And then manual muscle tests, which you all know and love by this point in the semester. So ADL tests are going to help identify motor dysfunction that limits an individual's ability to function in their home and community. So it's going to be objective tests that give scores based on that patient's performance. You see listed there 3 examples of ADL tests. In the clinic, usually these are performed by occupational therapists. So having an idea of knowing that they are a test for ADL measure is what you need to know. And if you needed to look further up, you could look up what is entailed in each of the tests. Functional strength tests are going to look at your patient's ability to utilize groups of muscles together to perform a task. You know that in class when we did manual muscle testing, all of those strength assessments were in the cardinal planes, either in the sagittal, the frontal, or transverse plane. And so we know that in function we are going to move in multiplanar movement and be using groups of muscles at the same time. So these types of tests are going to look at that ability. Can your muscles work together? In addition to strength, these tasks will also look at postural control in both a static and dynamic activity, and the ability of our patient to perform weight shifts of their center of gravity within their base of support. Functional tasks can be focused more on a certain area of the body, whether it's the upper body, so the upper limbs and trunk, upper trunk, or the lower trunk and lower legs, or it can be an activity that's going to encompass the whole body. And there you see some examples listed on your in this module on Blackboard. You see a video for the chair rise and the floor rise test, so please take a look at those videos. And the third category of strength assessment is the manual muscle test, which you are quite familiar with at this point in the semester. And we do sometimes group muscles when we look at the strength testing as well, like the hip flexors or the hip extensors. But we are still looking at the movement within the cardinal plane and not in a multiplanar motion. So we are going to continue to compare these functional tests to what you've already learned in manual muscle testing. We're going to look further into alternatives to manual muscle testing. Some of them will use equipment, some will use functional positions, and so you can see listed there these different 5 categories we are going to discuss further in the upcoming slides. If you're looking at measuring pure strength, then the 1 repetition max test is the gold standard for muscle strength testing. Yes, even more so than manual muscle testing, because if performed correctly, you will get an objective number of the amount of weight that the patient can lift, and will not be left into interpretation of knowing how much resistance did you provide for that patient. Could be more time consuming though if you're going through all of the using equipment to go through each of the ranges of motion, and that's why manual muscle test, which is much more efficient in the clinic, is used more often. But the 1 rep max test is the amount of weight that a patient can move through a full controlled range of motion once. We can be used for if we're looking at trying to set up an exercise program and to show progress for our patients. So it's important to know that when you do perform a 1 rep max test, you do have warm-up. So you're going to have your patient do 3 to 5 reps at a sub-maximal weight to do as a warm-up. And then you're going to select an initial weight that you think is about at 75% of that patient's capacity. And then you can add up to 5 to 10 pounds for each rep. And only up to a total of 4 reps can be performed, because at that point the patient will probably be reaching a point of fatigue, and so it would not be an accurate measurement. So the patient has up to 4 reps to decide what is their heaviest weight that they can lift for one repetition. It's important as the PTA, if you are performing this, to make sure that your patient does not hold their breath and maintains proper form. There's different equipment that we can use in the clinic to help assess strength. We could use machines like the leg press, and it could be used, as we were just discussing, with a 1 rep max. Or you could also use the leg press and be able to record, the amount of weight and the reps that the patient was able to perform, and use that as a way to show progression. Also using free weights, and it's that same idea. How much weight can they lift? Can they maintain the control while they're doing the free weight exercise, and how many reps can they perform? There are handheld dynamometers which you could utilize, and you would place it where you would put your resisting hand during manual muscle testing, and then that handheld dynamometer will give you a reading in pounds to show you the force that the patient's able to maintain against. Let me know if you see any of these being utilized in the clinic. You could also use TheraBand. We know that the different colors of TheraBand have different levels of resistance. So by recording or documenting the color of TheraBand and for the exercise or activity and how many reps, it's another way of showing progression or muscle strength. And then a handheld dynamometer for grip strength, which is different than the one I just described a few seconds ago. And we will utilize this in lab, and it's something that you'll have your patient grip hold of and squeeze, and it'll give you an output so that you can have an objective number to measure grip strength. Some more alternatives to manual muscle testing would be looking at test for power, seeing that explosive strength. And a lot of times this will be with your patients who are athletes and are trying to return to their sport. It could be something where you're using a medicine ball and trying to do overhead throws. A vertical jump, which you see in the picture to the right, of seeing how far a patient can reach and jump with using a ruler. Or hop test, which would be forward or backward progression on a single limb, and just measuring the distance that was hopped. Now they do show different ways you can score this in the book, but the best might just be to test that patient and show progression within that patient or relate it to their sport. Also, we can do body weight testing. Plank test is being able to maintain, and you see the position in the picture again to the lower right corner of maintaining a plank position. Normal values that we should be able to hold it for 60 seconds, and the textbook does equate this to being a score of a 5. And if you can hold it less than 45 seconds, it would be a 4. If you can't hold the position, it'd be a grade 3 or less. Again, I think the best thing is just looking at can your patient achieve the position, how long can they record the seconds or however long they can hold the position, and then try to show progression from there. Can also do chin-ups, push-ups, again looking at the number the patient is able to perform and showing progress by increasing that number. Maybe for fun, take a little break, put us on pause and see, can you do a plank? How long can you hold your plank? Can you hold it for 60 seconds? How many push-ups can you do? You might need to get up and move around a little bit, so this would be a good activity to throw into this PowerPoint presentation. The CRX method, or selective tissue tending testing, we discussed in the very beginning of the semester when we started to talk about manual muscle testing and function. But what it is a method that is used in the PT diagnosis of our patients and trying to differentiate between contractile and non-contractile tissue of what is the actual impairment. So if we think about it, if our patient, if we have them do active motion and then we do passively, and if they have pain with both active and passive motions, then we are thinking that it's something that is not contracting, because they have pain when all of the muscles and tendons are at rest. They still have pain. So then we're thinking it's something like ligaments, it's the bone, it's the joint capsule. However, if they have pain actively, you ask them to actively flex their shoulder and they have pain, but when you lay them down in supine and you test shoulder flexion passively, they have no pain, well then you are thinking that it is something that is contracting. It's the muscle, it's the tendon, because when it's at rest there is no pain. So on the slide here's an example that a PT might be trying to determine if the patient has lateral epicondylitis, or is it something going on with in the elbow of joint arthritis or joint capsule or ligament impairment. So you would have that patient go into wrist extension, and you would resist it or just have them actively extend and see if they have pain, and then you would passively put their wrist into extension and see if there's pain then. So if again they have pain both actively and passively, you are thinking tissues that don't contract. You are thinking ligaments, joint capsule, bones. And if they had pain with the active wrist extension but no pain when you did it passively for them, then you're starting to think muscle tendon, and yes, they probably do have the lateral epicondylitis. What goes along with this is if you do think that it is a contractile tissue, if you then put that muscle on stretch, so if we went into then wrist flexion, they are probably also going to have a reproduction of pain, because we are putting that that muscle that was painful now on stretch. And if you have questions about this, please ask me in class. We can talk more about it. When we are looking at our patient's strength, it is very important that we can tie their strength back into function. This has been a big push from insurance companies, that they don't just want to see an increase in, say, a manual muscle test from a 3 to a 4, but what does that mean? What can that patient now do functionally because they have had this gain in strength? And functional performance does not always equate to improvements or even maybe not showing progress in a manual muscle test. And that is because functional movements are quite different than manual muscle test. They are multiplanar. They are having rotation. They're asymmetrical. We move at different speeds throughout a task. They are often always require balance. And so someone can improve in their manual muscle test score for shoulder flexion, but may not still be able to reach into their cupboards up above their sink. And so we do always have to tie it into function. And so now this part of the PowerPoint, we're going to go into specific functional tests that you can use in the clinic and use in your documentation and be able to show progression and have it truly directly relate to a functional task. This chart is showing you different functional movements and what are the key muscles. It's not necessarily all the muscles listed in the task, but what are some of the key muscles, and are they functioning in open or closed chain or concentric or eccentrically? And it's just for you to get an appreciation of all of how these muscles work together to accomplish this task. And then also to think how we must strengthen our patients so that they can improve this and this function if they're with us in the clinic. There are many functional performance measures and functional tests. We are going to focus on the ones listed on this slide, and that they are also in your textbook. Some functional tests will have had research performed so that we have norms. Sometimes you'll just be able to show improvement from that patient from beginning of therapy towards the end. So we're going to go through each of these as when you come into class so that you'll have a great understanding of what the specific test requires. Please bring your printed out PowerPoint with you to class. We will be breaking up into groups, and each group will be assigned a different functional test or functional performance measure, and you will be sharing with the class what's listed on the slide, the purpose of the test, a demonstration of the test. How do you score it? What is normal? What important information does it tell us? And is there any perceived limitations that you can see to use this in the clinic? So again, bring your PowerPoint with you. We will divide up into groups in class and perform this as a class activity.